Hey there, it's Dr. Justin Marcagiani. Welcome to Beyond Wellness Radio, where we provide actionable health information on a week-to-week basis that can help you improve your life. Feel free, head over to justinhealth.com, where we have various opt-in video series on more in-depth health topics such as female hormones, thyroid, and gut health. Also, while you're there, feel free and schedule a consult with myself, Dr. J, and or my colleagues. We're available worldwide to provide natural health support for any of your major health issues. Again, welcome to the podcast and enjoy the show. Hey guys, it's Dr. Justin Marcagiani here. I am with Lisa Pomeroy. Really excited to have her on today's podcast. We're going to be chatting about different kinds of lab tests, everything labs, really. Our goal today's show, we're going to be really diving into gut tests, really looking at gut function. One of the big tests we'll look at is the GI map and how to interpret that and some of the big take homes as we go through that to pull out action items as we address patient concerns. And the next one we'll go into is the ion panel, where we'll get a really good window into mitochondrial function, neurotransmitter function, overall nutrient absorption, gut function, et cetera. So really excited to have Lisa on the show today. Lisa, how you doing?
Doing good. How about yourself?
Hey, doing wonderful. Really excited to chat with you. Very good.
Yeah,
Awesome. So why don't you let people know a little bit more about yourself? I mean, you're a clinician as well?
I am. Yeah, I'm a traditional naturopath. I've done a bunch of different functional medicine training programs. So, like you, I'm a graduate of Dan Kalish's Kalish mentorship. So I love learning. And a lot of the learning was something I had to do to try to get myself healthy. Because when we talk about gut issues, I had major gut issues. I mean, as young as like seventh grade, I was having ulcer-like pain. And unfortunately, no one I went to knew about H. pylori, knew about testing for H. pylori, treating H. pylori. So I had to suffer in silence for another 20 years with severe stomach pain before I ran the test on
Wow.
myself, found I had H. pylori, and got rid of it.
Wow, that is crazy. What a
Yeah.
story.
Yeah,
I
I
mean,
come home
especially
from
for
school and drink cabbage juice. I mean, I was
oh
that
yeah.
devoted because it's the only thing that would help.
Yeah, intuitively you knew the vitamin U in there was helping. Yeah, so you really had to
Exactly.
wait a long time. So that's crazy because you must have so much appreciation for what we all do today. You have a
I
lot of empathy for
do.
your patients. That's great. It's important to have that.
Yeah, I talk to people and we'll talk about like a 5-year-old child or something. And I'm just so grateful because it's like, I'm so glad that they have that the parents know enough to be getting this child help so they don't have to suffer like I did for another 20, 30 years with severe gut pain. We find out they have a nasty parasite in their gut and we get rid of it and they're not going to be nutritionally deficient and have all of these gut symptoms for decades.
Oh, totally. Yeah, and it's important. I mean, obviously out of the gate, the labs are important. They give us a lot of information that's clinically actionable. But,
Mhm.
diet and lifestyle foundational things, a lot of these, we probably don't need a lab test per se. I mean, it's good to have it,
Mhm.
right? It's nice to know, like, okay, maybe there's some gluten sensitivity, maybe there's some inflammation, maybe
Mhm.
there's some immune activation, and we should kind of start with some diet changes. Are there some foundational things that you tend to find that just generally help most people out of the gates? Maybe
Mhm.
sugar, gluten. What things do you specifically utilize?
Yeah, exactly. I mean, we look at the top pro-inflammatory foods in the diet. Most people say gluten, dairy, white refined sugar, and ultra-processed foods. Those are going to be some of your top things where a lot of people will notice a difference where you can pull it out. You can do a trial where you eat whole unprocessed foods, your whole fruits and veggies, roots and tubers, that sort of thing. You cut out the
Hmm.
dairy, you see how you do. So yes, testing can be helpful with that, but some of it can just be, take it out and see how you feel.
See how you feel. Yeah, that
Exactly.
makes sense. Well,
Hmm.
cool. Well, why don't we dive into some of the GI map testing out of the gates? I got a sample patient here. We'll pull it up on screen
Okay.
and we'll kind of whip through it and we'll try to keep it actionable. I mean, unlike a lot of shows, you're a clinician, I'm a clinician, you interact with patients and doctors throughout the week. And so we're trying to get people real actionable information here.
Yeah, great.
Can you see the screen here?
I can. Yeah, it's coming through nice and clear.
All right, cool. So we'll just kind of start off out of the bat here, page one. So we're looking at a lot of bacterial pathogens, some parasite pathogens, and viral stuff. I'll let you kind of take it away with the first part.
Sure. Yeah. So basically, what I want to see on this first page is nothing. These are
Mhm.
things that really don't belong there. So I want to see that less than DL, which stands for below the detectable limit for all the things down the page. Now, some of these we don't necessarily need to intervene with, like that E. coli 017, 0157. That one is something, it's an acute pathogen. It's actually like a foodborne pathogen.
Hmm.
And we've been seeing a lot of these pathogenic E. coli's lately. They do tend to peak in the late summer months. So July, August, September, we see a lot of them just because they're on the fresh produce, the leafy greens, your lettuce, your
Yeah.
basil, your berries. So you pick them up. And so we're looking for symptoms. Now, this case, this is a very teeny tiny little level, E0. So that's something they either just picked up a very small amount or is mostly on its way out. And that's where an E. coli like the 0157, is something that's considered transient, self-limiting. It'll go away on its own. Now, it may or may not give you symptoms. If you did get symptoms, they probably last for less than a week, probably get some diarrhea, some cramping, fever, nausea, that sort of thing. So sometimes we'll see these on the report and we go, okay, well, that explains why you had diarrhea 2 weeks ago. You
Yep.
got a hold of this bug, but it may not be something we actually need to do something about.
But every
Now,
now and then you see the 01H57. I mean, you see that with spinach a lot, and people will die every year with it. So it can be serious if people have a compromised immune system or gut function, right?
exactly. And that's what especially the elderly, the young children, they are at greater risk of more severe types of infections. And that's where a lot of times people, and a lot of times they know that where, in the time, say they got some diarrhea, they ran the test, they're waiting for the results to come back. Usually those symptoms are going to peak before the results came back. So if they
Hmm.
know I'm having severe, things are coming out both ends, basically. I'm
Right.
puking, bloody diarrhea, they should know they need to go to seek emergency medical care.
Got it.
And that's something where, usually by the time we're seeing people, now most people don't get that severe, but if they did, they would have sought medical attention. So
Hmm.
usually we're seeing the side more like, oh yeah, I had loose stool for 2 days. My gut was a little off, you
Hmm.
know, so we may not need to intervene, although I always look for there's deeper, bigger issues because really, the body is meant to protect us from these infections. So if you were susceptible to picking up the E. coli on your spinach or your lettuce,
Hmm.
where was the stomach acid? Shouldn't that have come in and killed what you ate and went through your
Exactly.
stomach? Or what about secretory IgA? There's this marker later on the test that tells you about gut immunity. Secretory IgA, yep, there it is. Yep. So that one, if that's low, that's a problem because that can actually engulf pathogens so they can't attach to the bowel wall, can tag them so the immune system knows, oh, that's a bad guy. We got to get rid of it. So if you have good stomach acid, good bile, those are antimicrobials to kill things. If you have good secretory IgA, that's your gut immunity. That's going to protect you. It's our first line of defense. So again, if I see an E. coli, I may not need to do some kind of protocol to get rid of it, may just go away on its own. But I'm looking for the deeper issues. If you don't have good stomach acid, you're probably going to pick up E. coli again next summer or whenever you again eat something that has it on it.
That totally makes sense. I'll scroll back to here to page 1 so we can go in order. And then obviously we have some other food poisoning types of bacteria here, Campylobacter, salmonella we may see in chicken. Do these change anything for you if someone still has something lingering and some gut issues? I mean, you're still going to try to address it with some herbals when it's appropriate.
Exactly. Yeah. Some of these, and there is, research keeps coming out where we're thinking something like Campylobacter. We think it's something that just temporarily stays in the gut and then it's gone. It's kind of like a hit and run where it does its damage and then it
Hmm.
leaves, the gut repairs. But in some people, they've actually done some duodenal aspirates and find that, they can actually find it still in the gut and the person hasn't had that recent food poisoning incident. So there is a little bit of a question with some of these, could they actually stick around a little bit longer? And that's
Mm.
definitely a problem too. So if they show up on a single report, say Campylobacter shows up, my initial assumption is, yeah, you probably ate some chicken or something lately that had it. But if I'm seeing repeated tests, maybe it's a chronic colonizer, or maybe you keep getting food poisoning. Maybe you're eating at some local fast food chicken place that maybe doesn't have the best quality chicken. Or
Hmm.
again, you have low stomach acid. It takes very few organisms to infect you if you have low stomach acid. So again, we need to look at, is this a chronic issue if we're repeatedly seeing it? Is this low stomach acid, low gut immunity? Something's wrong.
Exactly. And then same thing here. We have different types of sugar toxin, these are toxins actually produced by the E. coli. Is that correct?
Yeah, E. coli was kind of unique in that they're all pathogenic E. coli. You can kind of lump them all together, but they have different mechanisms of action, different toxins they produce. And so they kind of each got their own special name, even
Got
though you
it.
can all just lump them together. They're just foodborne pathogenic E. coli's.
That are going to produce different toxins that would create inflammation. So
Yeah.
either way, you're going to be, trying to clean out the diet and use some kind of an herbal to kind of knock it down, so to speak.
Yep. And I look at food quality. I also, because something like, again, chicken could be a source of salmonella,
Mm-hmm.
campylobacter. If you're eating conventional chicken versus organic chicken, they found, when they've actually done research studies on this, the non-organic ones are more highly contaminated with these bugs than
Mm-hmm.
the organic. Plus, they tend to be more antibiotic resistance. So say if you do get campylobacter or salmonella, chances are it's going to be a very nasty type that's not going to respond to treatment if you did need treatment. And then certain techniques too, like, personally, I get organic, pastured, air chilled chicken because there's, again, how is the chicken processed? They can put it in a chlorine bath, which is just essentially like a fecal soup. They have all of these chicken carcasses just in this big tub of chlorinated water. And so if you have one contaminated chicken carcass in this big
Yeah.
pool, it can contaminate other ones versus air chilled. They're kind of, just single hanging on their own. So again, they've done the research where air chilled is less contaminated with these microbes. So
Hmm.
again, whether you're susceptible or not, I mean, I still don't want to, I do my best cleaning my produce, buying good quality food. So we're looking at food hygiene, food quality, but you do things, the little things that you can too when purchasing these things to prevent your exposure.
Okay, cool. We also skipped, I think, C. diff out of the gate. So
Mhm.
C. diff is a bacterial infection. It's common in hospitals. High levels of antibiotics can mess up your gut and create an imbalance there.
Mhm.
Obviously, toxin A and B together tend to be more synergistic and worse than just one. Do you want to add to that at all? Any comments on
Yeah.
that?
Yeah, so a lot of people see this test and they panic when C. diff comes up
Mm-hmm.
because we know that C. diff can be a really nasty infection. However, we have to keep in mind what this test is measuring is the bacteria, not the toxins. So what this tells you is that there's C. diff bacteria in the gut that carries the genes that would allow it to produce toxin A and or toxin B. Whether it's actually doing that at the moment is the question. So
Mm.
what's defined as a C. diff infection is the bacteria are there actively producing the toxins, and the toxins are what are damaging the gut, causing the diarrhea, the classic C. diff presentation.
I
Now,
understand.
a lot more people are actually colonized with C. diff, where the bacteria is there, but you maybe have some good guys that are keeping it in balance, preventing it from turning on those genes and producing the toxins. And so that's where it's important to have the good bacteria there to not wipe them out by antibiotics or other things. So we can't differentiate between infection or colonization here. This is just telling us C. diff bacteria is there, and we don't really want it there. Now, if someone does have symptoms that indicate a possible infection, we certainly could do further testing and actually test those toxins to confirm. But a lot of people, if they say, well, I'm constipated, probably not a C. diff infection.
Mm-hmm.
It's if they don't present like those classic symptoms, it's probably more colonization, which is far more common. But I still don't want it there because it's essentially lying in wait, waiting for the opportunity. You get a UTI, you take around antibiotics. Now, again, you killed the organisms protecting against this. So now you do turn on the gene, get the toxins, get a C. diff infection.
So we have the bacteria that has the potential to make this toxin, but it's not necessarily the saying toxin A or B is present. It's more the potential of it based on the bacteria.
Exactly. This tells us about the bacteria, not whether toxins are actively being produced.
And this Clostridium isn't the same as on page 2. This one is this a little bit different. This is kind of more
Correct.
the overall class, where this is more the specific type of
Mhm.
Clostridia within that class. Is that correct?
Exactly. So C. difficile is a pathogenic organism that's part of that large group.
That family.
Yep.
Mm-hmm.
But Clostridia actually has a lot of beneficial butyrate producers. So this is
Okay.
just picking up, there's a very small subgroup of maybe more pathogenic, potentially harmful ones within the group.
Okay. Very good. Excellent.
Mhm.
Anything else you want to say down here? I mean, you mentioned kind of salmonella more connected to the chicken and eggs, things like that.
Mhm.
cholera more waterborne. Anything else you want to say about cholera or Yersinia?
Yeah, so Vibrio in the US, the most common source is actually seafood. So that's what
Mm,
I'm checking to see. It's like, okay, Vibrio comes up, which doesn't all that often, but once in a while it will. I just check, did you eat seafood recently? And it's always, oh yeah, I had some shrimp and, again, may or may not have had those acute symptoms, but, often there's recent seafood consumption. Now, in other countries, it's more through the water, through, just dirty water that has fecal
hmm.
contamination. Here, it's usually seafood.
Okay, very good. And then Yersinia, you said, is that seafood as well? Or that was just the Vibrio?
That's just the Vibrio. Yeah,
Good. And then how about
Yersinia,
Yersinia?
yeah, that one can come through many different sources. Sometimes it could be, even raw dairy products, could be pork, many different sources for food. But this one actually can be a trigger for Hashimoto's. So it
It
doesn't show
can.
up. It
Yep.
can, yeah. So it doesn't
Mhm.
show up all that often, but if it does, I'm looking at the thyroid antibodies on other testing or seeing if there's already a diagnosis of Hashimoto's.
Very good. And then
Yeah.
parasite wise, we have crypto, ehisto, and giardia, which definitely are the big three, right? Crypto
Mm.
primarily found in water. Ehisto is going to be a nasty little amoebic that people don't know. It's in the top 3 to 5 causes of death in third world countries. It's a nasty little bugger.
It
And then
is.
and then giardia as well, which loves to hide in the gallbladder. I'm going to let you kind of go into those one by one. Quick question: why do they have these parasites here, and then on page 4, a separate section for parasites? Why don't they put them all in one spot?
Yeah, my thought is that, within the medical community, certain pathogens now are widely accepted as disease
Hmm.
causing. So, like,
Yes.
pretty much, I mean, a conventional doctor, a functional medicine doctor, they're all going to say, crypto,
Yeah.
giardia,
These
ehisto
for
are
sure.
bad. We don't want to see those. Now,
Yeah.
blastocystis hominis, most functional medicine practitioners will say that that has a lot of potential to cause harm. Research
Definitely.
has linked it with Hashimoto's and, hives and IBS. But from the conventional standpoint, they're not entirely convinced because some
Yep.
people can have blasto and not have symptoms. So
Yep.
the ones on page 4, there is research supporting that all of them have pathogenic potential, but
Yes.
they're not as widely accepted as 100% pathogenic, unlike the
Hmm.
ones on page 1.
Makes sense. I know even people like Mayo Clinic are starting to say, hey, if you have blasto and have some level of symptoms,
Mhm.
well, you probably should address it. And, most people that we see, the problem is, well, what constitutes a symptom from blasto, for instance? Because we know a lot of gut issues can cause extra intestinal symptoms, i.e., fatigue, brain fog, mood issues, sleep issues. So then how do you really connect the dots? Obviously, we have diarrhea, constipation, acid reflux, bloating, right? But sometimes you get these extra intestinal ones, which are a little weird.
Exactly. Like blasto, people say, oh, well, I have no gut pain. And then I start asking more about their symptoms like, oh, well, I do have chronic hives and I have joint pain and I have, these other symptoms. And it's like, well, I can show you a research study that's linked that to blasto. Yes, it's not a gut related symptom, but it's been linked to blasto.
100%. Yeah, very good.
Yeah, yeah. So going over the page 1 pathogens. So yeah, Cryptosporidium, Giardia, those are actually both small intestinal infections, whereas the
Hmm.
E-histo is a large intestine infection. But Crypto and Giardia often can be from the water. So we do have to look at drinking water. And for Giardia, recreational water can be a big source too. So again, a lot of
Yes.
these pathogens have their seasons. So Giardia we can see more prevalent in the summer months because people are going and swimming in lakes and streams and rivers and swimming pools and, or going whitewater rafting or, doing things, recreational water parks. And you just get a mouthful of water and chlorine doesn't consistently kill it, unfortunately. So
Yeah.
you still could get it, or it could be your well water. So I always look too, if we see Giardia, what are you drinking? Are you drinking well water? Is it filtered? Do you swim in lakes and streams, ponds? Do you have a
Right.
swimming pool? So we always want to look at that because sometimes if it is well water and it has Giardia, and you can often test your water for these bugs too, we want to make sure we're getting rid of that source. But yeah, I mean, these can be nasty. Again, you can pick them up on the food. All of these have what they call the fecal oral route. So
Right.
basically, if, again, it could be animal poop and stuff that just gets on your leafy greens because your
Yep.
cattle farm is next to your lettuce farm. There's a little
Yep.
runoff. And yeah, and it's hard to wash your produce. I mean, I still recommend soaking fresh produce in water with a little vinegar or hydrogen peroxide in it to try to kill those bugs. But even still, I mean, lettuce has so many little nooks and crannies. It's hard to get it all killed.
Absolutely. And we probably want to make sure every patient that we see or clinician that we see is recommending a good quality water filter, at least a carbon-based one, or ideally even a reverse osmosis, just to really make sure we filter out all those potential parasitic cysts. Plus, water's got a whole bunch of other nasty things in it, like chlorine, like potential fluoride and pharmaceuticals that you want to filter out as well.
Exactly. Clean water is a must, whether it's the bugs or the toxins.
Exactly. Any other comments on the viral pathogens here?
Yeah, again, those, again, tend to be acute rather than chronic colonizers. Although, again, norovirus, there is some evidence it could be a chronic, but, these will feel often like a stomach flu. So, again,
Mhm.
you usually pick it up from more your food, like food poisoning. But some of these you could pick up like
Mhm.
norovirus. Say you go to a public restroom, you touch the faucet handle, and then you eat your lunch without washing your hands. If you touch something with the virus, you put your hands in your mouth, you could pick up something like norovirus from touching objects too, but
Makes sense.
usually feels like a stomach flu.
Okay, cool. Well, let's dive into H. pylori here next. And also just a little reference range tidbit for a lot of folks here. If you're trying to figure out the reference range, you see, I don't know, let's go on to, let's see, where's a good example?
Well,
So
H.
you see
pylori is
E.
a
coli.
good one too. Yeah.
Yeah, but if you look at E. coli, you're trying to figure out where this fits in the reference range. If the exponent is below the reference range, then you got to move to the left. So this really is 0.00860. And then if it's above, like this is e to the 5, right? Then you have to move to the right to make it just to make it equal. The exponents tend to throw a lot of patients off that I find when we go through them all.
Exactly. Yeah. And it's in scientific nomenclature just because
Nomenclature, yeah.
otherwise
Big
you'd have a
numbers.
ton of zeros. Yeah. So it just
Exactly.
cleans up the report. So,
Exactly.
and
And
there's
then,
nice, like these are powers of 10. So you can get like powers of tens chart, like E3 is
yes,
1,000. So you can go, oh, that's E3 is 1,000, take the 2.9, multiply it. That's
right.
2,900 cells.
Exactly. Exactly. And then real quick here with the H. pylori, I haven't seen the last year or so a ton of virulence factors come back on my patients. Have you seen that? Has the lab kind of toned down the sensitivity with that? What have you noticed?
It depends. Fortunately, we don't see them that often, which,
Hmm.
I mean, the problem with virulence factors is they've been associated in the literature with higher risk of gastric cancer,
Hmm.
gastric ulcers, cardiovascular disease. So if you have H. pylori that has these attached to it, it has more potential to cause harm and disease. Now, I just saw one actually yesterday where she has a history of H. pylori, and fortunately she got it back again, and it pretty much looked like this one. It had like
Hmm.
4 or 5 virulence factors, which is what she was dealing with before too. So we do still pick them up. Again, fortunately, it's not as often because this is the really nasty type of H. pylori you don't want to see.
Exactly. And then regarding the reference range, this is above 1. If
Mhm.
someone's borderline or a little bit below, would you typically want to treat them? Or let's say if they had symptoms, would you still want to treat them?
Yeah, so it becomes more of a clinical decision if
Hmm.
it's below that 1,000 cell threshold. But we have had people have like, this is a 2.9 E3. We've had people like a 2.6 E2, which is just 260 cells. They've had endoscopies and been told that their stomach was covered in H. pylori and highly inflamed. So sometimes this can be tip of the iceberg. We have to remember, where is this infection located? This is a stomach infection. So something in the stomach, it depends how much is being shed into the GI tract that day. It's got to travel 20, 22 feet through the intestinal tract to come out the other end. So
Got it.
sometimes this is going to be heavily diluted from what we started out with.
It can
So
get
this could
diluted.
yeah, so this could be just a glimpse of what's there. So
Yep.
that's where there is, it comes down to that clinical decision. Does this fit?
I
If
agree.
someone comes in and they have gas and bloating and GERD and reflux and stomach pain, and I see a borderline level, a moderate positive, I'm probably going to do a protocol because
Yes.
it fits. Now, if this was a very low level and they had absolutely no symptoms, and I looked through the rest of the report, their microbiome looks good, their enzymes look good, their gut immunity looks good, maybe it's okay. Maybe they have good lactobacillus and things keeping it in check, but I want to see signs that it's not causing any harm. So that's where I look at the symptoms, the history, the rest of the report.
That makes sense. And then with these cytotoxic proteins, are these more genetic type of risk factors because of the genes, or are they specifically connected to the H. pylori? And if we
Yeah,
knock down the H. pylori, we'll knock down these cytotoxic proteins.
exactly. So these are genes attached to the bacteria. They're not related to the person. So
Got
as
it.
you kill the bacteria, the virulence factors go with the bacteria.
Got it.
Yeah,
So you
but like
can clear them as the bacteria gets
you
knocked
can.
down. You can knock down the bacteria that has those genes attached to it.
Exactly. Like if you have BAB-A, that just allows the H. pylori to stick to the stomach a little bit better. So we might bring in a little cranberry juice because
Mm.
that has an anti-adhesive property to it. So we just try to undo that little trick that the H. pylori has, which here the BAB-A allows it to stick. So we're going to do something to make it so it can't stick.
Oh, would that be a good recommendation if you had H. pylori without the BABA?
You could actually, because there is research that just shows that cranberry juice seems to kill H. pylori and just prevent it from sticking to the stomach wall. So with BAB-A, I definitely include it, but I also often include it just with H. pylori.
And then if you address someone like round one and there's still some H. pylori left, or you didn't move it a ton,
Mhm.
are you going to try a second round with different herbs and just kind of mix them up? How do you address patients where you don't quite get the result you want the first round?
Mm-hmm. Yeah, and this is when we're using herbs, especially the herbs we traditionally use, things like mastic gum, DGL licorice, they don't have a major impact on the beneficial flora. So it's not like we're going in there with some really super strong herbs a lot of times that will just knock out everything. And so we can often use repeated rounds of some of those herbs safely without disrupting everything
Mm-hmm.
else. But I have had people where, especially skin conditions, where until we get that H. pylori less than DL, their skin won't clear up. So for me, I look to see now if they're feeling great, if we knocked it down and there's a little bit, again, it's always a judgment call. But I've seen people with acne, with eczema, where until it hits a less than DL, they have the symptoms. The second they hit less than DL, they're gone.
So are there any other herbs that you'll pivot off of the mastica, or that you'll use synergistically with it, or that you'll rotate in if first round didn't work, that you'll pivot on the second or third round with?
Mm-hmm. Yeah, so a lot of times other organisms can actually promote the colonization of H. pylori. Like yeast is a big one I look
Yep.
for because
Blasto
there's,
too.
yep, yeah, and there's actually research that yeast and H. pylori have what researchers call an intimate relationship.
Mm.
So basically, if there's yeast and H. pylori together in the mouth or the stomach, the H. pylori can go and hide inside of the yeast and kind of seek refuge inside of it, and then later come out when the coast is clear. So if I see a bunch of yeast on the next page, I may need to bring in some antifungals at the same time of trying to kill H. pylori, or it's just going to hide out and just come out later. So that can be something we miss. You know, H. pylori can produce biofilms and hide inside a yeast. Some bacteria produce hydrogen, and that hydrogen also can fuel the growth of H. pylori. So that's where sometimes I do look at, okay, let's bring in some berberine, some oregano, some neem,
Mm.
some pau d'arco, silver, something that's going to also address the bacteria or the yeast, or some biofilm disruptors like NAC and acetylcysteine can break down H. pylori biofilms. So I'm thinking about all of those things because those could be what we're running into a wall.
Makes a lot of sense. Very good. Any other comments on the H. pylori? And then also, like, what are the big virulence factors to look out for?
Mm-hmm.
So, like a top three.
Yeah, I mean, some of the nastier ones where we're thinking more like gastric ulcers, gastric cancer.
Mm-hmm.
KEG-A is one of those big nasty ones. DUP-A, the DUP is duodenal, so that one's a little more duodenal ulcers.
Got it.
VAC-A, that again is another one where ulcers cancer. So I'd say the three worst one, the KEG-A, the DUP-A, the VAC-A. I mean, yes, BAB-A is not a good thing, but it's more allowing it to stick to the stomach a little bit more. It's going to be a little more invasive, a little more inflammatory, but you know, those other three are just especially nasty.
Got it. The CAG, the dupe, and the VAC.
Yeah.
Okay, very cool. And now we go into the normal bacteria. These are commensal flora, normal flora in the gut, but we can
Mhm,
kind of gain a little bit of insight on what's happening in the gut based on these imbalances. I mean, out
mhm.
of the gates, we have, just out of the gates, we have lactobacillus, which is a beneficial flora that's low. So we're starting to see low levels of beneficial bacteria. Anything else you want to say kind of from this section down?
Yeah, and again, we can tie this with other sections too. Like
Hmm.
lactobacillus actually lives in the stomach, and it's very antagonistic towards H. pylori. So if I'm looking at this and going, well, we have a nasty H. pylori infection, we have low lactobacillus, I'm going to get a lactobacillus probiotic in here to try to help not only get more lactobacillus in the system because it's clearly lacking, but also it's going to help push out some of that H. pylori from the stomach. Now, in general, I look at, do we have highs? Do we have lows? Because even though these are good guys, too much of a good thing is still a bad thing. So I still don't want to see highs or lows. Now, a lot of times when things are low, it's often something killed them. So I look for a history. Did you take antibiotics recently? Or
Hmm.
things like artificial sweeteners, like, Splenda, sucralose. It's a chlorinated sugar. Chlorine kills bugs, including the good bugs. So we need to be looking at, again, the diet. Are you doing something that's killing these? Do you eat GMO foods, food sprayed with glyphosate? Glyphosate is patented as an antibiotic. Again, it's going to kill your good bugs. So are you doing something that's killing them? Or are you starving them? You gotta feed your bugs, and they like fiber. So if you're restricting fiber in your diet, if you're not eating lots of whole fruits and vegetables and beans and nuts and seeds and maybe some gluten-free grains, I mean, all of these things have the fibers that these guys love.
100%. And so a lot of fibers, a lot of fruits, a lot of vegetables. If someone were to go carnivore, would you see a lot of these commensal flora drop typically?
You do, unfortunately. Yeah, unfortunately, we have seen some reports for people who are doing carnivore, and especially if there's low stomach acid, especially if there's H. pylori, you'll see a lot of the ones, the opportunistic ones on the following page go really sky high, and you'll see lots of low levels here because these guys like their fiber. Now, we don't test some of the bile-loving bugs here, but if you were testing those, we would expect to see some of the protein degrading, bile-loving ones. Those are the ones that are going to go up, but they're also ones that produce things like hydrogen sulfide, which can be very pro-inflammatory in excess. So while it may relieve some symptoms, I'd rather look at why can't you digest your fruits and vegetables and carbs and that kind of stuff. There's probably an infection like H. pylori or some dysbiosis. Instead of restricting your diet so severely and starving your good bugs, let's get rid of these bigger issues, get you digesting better so you can have those foods again.
Very good. And so out of the gates, are there any specific changes that you're going to make outside of those recommended diet or lifestyle things for like Faecalibacterium prausnitzkii or Akkermansia? Any specific changes there?
Mm-hmm. Yeah, so Faecalibacterium prausnitzkii is the major butyrate producer. So butyrate's very anti-inflammatory in your gut, but it also has an effect in the brain. Butyrate produced in your gut will cross your blood-brain barrier and have an anti-inflammatory effect in your brain, stimulates BDNF, brain-derived neurotropic factor, can help with anxiety. So again, we're not just looking at a gut impact here. We may see this is low with skin conditions and anxiety and all these other issues. But this loves fiber, loves resistant starch. So I might suggest, let's eat some, rice that's been cooked and cooled, or some potatoes or roots and tubers that have been cooked and cooled. Because if you cook these foods and then you cool them, it creates resistant starch. So like something like potato salad would, Faecalibacterium prausnitzkii would be really happy with some potato salad. But also your fibers, fruits and veggies, roots and tubers, all of that stuff. But it wants fiber.
Very good. And what
Now,
if some of those foods cause people to get more bloated or gassy? Like let's say they have issues with nuts or have issues with legumes or lentils. Would you suggest they continue to eat that even if they feel bad, or listen to their body on that?
yeah, we always want to listen to the body. Some foods are just harder to digest than others. So some people, especially if your gut is very damaged and inflamed, maybe you can't handle the beans, legumes, lentils right off the bat. So we find different foods, other fiber rich foods that don't cause that discomfort. And sometimes it's about portions too. So something like an apple, maybe you can't have a whole apple because it has a lot of fermentable carbs, but you can have 2 apple slices. Or you can't have a whole plate of asparagus, but you can have 2 spears of asparagus in a stir fry. So we always look at those things, but I also look at enzymes. If you don't have enzymes to break down these foods, you're probably not going to feel too good with them. So I'm always looking at elastase 1 again later in the report. If that's low, I'm bringing in a pancreatic enzyme supplement because that not only helps with your gas and bloating and all those digestive symptoms, but also helps with some of the dysbiosis because if you're not digesting your food, your bugs will. So you're giving them an all you can eat buffet if you don't digest your food. So enzymes are really key. And they've actually done some really cool studies finding that low elastase 1 is actually more influential on your microbiome than your diet and all these other factors. Having poor digestion will highly influence what's growing and not growing.
Very cool. Anything else you want to say about the different families of bacteria? So the conventional thinking is bacteroides, very helpful, very important to have in your tummy, good amounts. Firmicutes, the high levels of this one tend to, so that, the B for bacteroides, B for beautiful, very beneficial. Firmicutes is one of these ones where high levels increase calorie extraction, which potentially some correlation with weight gain in the literature. Any comments on these?
Yeah, so again, it's all about balance. So Firmicutes is actually where a lot of those butyrate producers are. They're in this category. So both, we can't say that either one is good, one is bad, but there are good guys and bad guys in both categories. So it's just all about having that balance there. And yes, Firmicutes, they can, make you retain more calories from your food. So you could gain weight if they're abundant. But I'm looking at if your Firmicutes are getting too high, it's probably you're eating too many carbohydrates or you're not digesting them.
Right.
So again, if I see this high and your enzymes are low, I'm getting those enzymes in there and we'll often see this balance out.
Yeah, and then you may want to address either fermentables, FODMAPs, or even go lower carb as well.
Yeah, depending on it. Again, I look at symptoms. I mean, I don't want to starve the colonic bacteria. So I'm just, a lot of times just finding which fibers are triggering symptoms. Can we get some enzymes in there? There's actually enzymes now that are specific for digesting high FODMAP foods. And so I'll bring in something like that where, they'll say, well, I love onions, but, I just get such terrible gut pain afterwards. You take this enzyme, you can eat onions. So your microbiome loves onions. Yes, they are highly fermentable. They can cause more symptoms. But if you get the proper enzymes in there, a lot of times you're fine and your gut microbiome will thrive on those foods. So cool. I'm very careful about what I take out because, I don't want to trigger symptoms, but I also don't want to starve the bacteria.
Very good. And then what about increasing bacteroides? Anything specific to help with that?
Yeah, so maybe again, it's something, if they're low, we think about, fiber, again, the whole like more plant focused foods. But something too we know about Bacteroidetes is they don't like excessive fermentation. So that's where, again, I look and connect the dots here. H. pylori showed up. H. pylori in most people causes low stomach acid. If your acid's low, you're probably excessively fermenting your food. Bacteroidetes don't like the pH shift that occurs as a result of that, so they're just not going to do well. A lot of these bugs, what's growing is going to be determined by pH and oxygen levels. So chances are, if you get plenty of fiber in the diet, you get rid of that H. pylori that's suppressing the acid, causing excessive fermentation, these again could just balance out.
Very good. Excellent. And then anything else? Let's hit the dysbiotic bacteria section. So these are quite frequently going to be found in general dysbiosis or SIBO, right? Bacillus is kind of this beneficial spore-like probiotic that you get in Megaspore or Thrive or a lot of these newer probiotics that are out. Why don't you take it from there? So with this one, there's a certain threshold that you like to see it stay below, but if it's a little bit high, is that okay?
Yeah, so bacillus, actually, a healthy gut should have some bacillus in it. So this is one we actually see a number next to that bacillus species on every single report. So an E4, E5 is actually pretty typical. With this one, I'm actually more concerned if I see a less than DL. to me, that's more of a deficiency of this. So, if it's low, I mean, again, we think about the diet and all of those things. We can supplement since we do have them available in probiotic form. Now, if it's high, there's been a link between poor digestion and excessive levels. So if it's going high, I tend to think, okay, what's going on with stomach acid, with enzymes, with all of those things? So that's what I'm usually supporting if it's getting high.
Very good. Excellent. Probiotic, enzymes, if it's getting high. Anything else with restriction of carbohydrate or FODMAPs at all?
With that one, I don't usually do too much. It's more just focusing on if something's causing low stomach acid, like H. pylori, we need to deal with that bigger issue. But it's often more just poor digestion, digestive dysfunction.
Very cool. Anything else you want to say about the general dysbiotic bacteria below? We could start with the dysbiotic section. I mean, is there any rhyme or reason of why one may proliferate in someone's gut over another, or is it just kind of the dumb luck of, too much sugar, too much carbs, antibiotic exposure, not enough beneficial flora to compete? Why would one proliferate over another?
Yeah, so there's definitely certain conditions that will promote some over others. Like we see Klebsiella there in that bottom section. It not only causes inflammation, but it loves inflammation. If your gut becomes inflamed, it's going to bloom. So with this one, if your gut's inflamed because you have a, crappy diet, because you're eating a bunch of food additives and pro-inflammatory foods, you're lacking those good butyrate producers, all these things have changed in your gut to make it inflamed. That's going to make your Klebsiella very happy, and it's going to become overly abundant like this. Or things like, certain things have been tied in the research with low stomach acid. So streptococcus, one of the top things you're going to see with low stomach acid. So again, this individual is dealing with H. pylori. So we're probably going to see some high streptococcus, which we do. Besides streptococcus, staphylococcus tends to show up with low stomach acid. Again, right above that, there it is. And enterococcus. Now, enterococcus here was more a moderate overgrowth, but still it is showing up a little bit, which it's fitting with this pattern. The more things that you have showing up that fit that pattern, the stronger it is. So I'd say the enterococcus, the staph, the strep, Klebsiella we'll see more with low stomach acid, and even Pseudomonas. Pseudomonas thrives when there's a lot of undigested protein around. So that's another one where this page to me looks like a classic consequence of having low stomach acid. So again, we have to think upstream what's causing that, correct that. But we also may bring in some antimicrobial herbs because this has gotten to such a state where we may not be able to just get rid of these by dealing with those bigger upstream issues like H. pylori and low enzymes at this point.
So the enterococcus, staph, strep, and Klebsiella, when you see them elevated, there's going to be more of a connection with low stomach acid and probably low enzymes too, because those are connected as well, right?
Exactly. We often call this the digestive dysfunction pattern.
Okay. How do artificial sweeteners impact this, or even things like pesticides? Will they have a kind of a negative impact like an antibiotic? How does that work?
Yeah, they can. That's what they find. A lot of the artificial sweeteners, they find that they tend to kill things like lactobacillus and bifidobacterium, and yet they promote, a lot of times it's this one other phylum, which is called proteobacteria. So Klebsiella is a member of proteobacteria, Pseudomonas is a member of proteobacteria, but they're really virulent, more pro-inflammatory organisms that will tend to bloom again with more inflamed conditions, higher oxygen, and they also tend to go up when we have food additives and chemicals and pesticides and all of that. So you see it a lot of the research. It's kind of like the bad dysbiosis pattern you'll see is these high proteobacteria, like again, high Klebsiella, high Pseudomonas, with low butyrate producers, like low Firmicutes, low Clostridia, low Faecalibacterium prausnitzii. So too many pro-inflammatory bugs, not enough anti-inflammatory bugs.
Got it. And so lower butyrate, not enough anti-inflammatory bugs, and that's more with what? Prevotella, Proteus, Fusobacterium. Those are the big ones there?
Those are going to be your more pro-inflammatory ones again. Yeah, anything in your potential autoimmune
with low butyrate.
section. With low butyrate, yeah, because that's going to change the environment that will promote their growth.
And so when you're working on producing butyrate, I mean, can things just like butter, which is butyric acid, can that have an influence? Are you trying to also add in potential resistant starch or prebiotic fibers,
Mm-hmm.
or adding just actual butyrate in there? What are your thoughts on each one of those, and what do you do to try to impact butyrate?
Sure. Yeah, I mean, butter or ghee does have some butyric acid or butyrate. It's just, it's so small, it'd be hard to get therapeutic amounts. Plus, a
Mm-hmm.
lot of people are dairy sensitive, especially
Mm-hmm.
when their gut is damaged and leaky.
Yep, can be for sure.
Yeah, so if I'm going to supplement or try to get more butyrate in, I look at, I mean, we could use a tributyrin supplement. That can be
Mm-hmm.
really great. Like if I see if all the butyrate producers are low and their calprotectin is high, which is telling me their gut is inflamed, and they have a lot of GI discomfort, and they also have a lot of food sensitivities, getting that butyrate in there directly can often calm things down. Or diarrhea. Butyrate can be terrific for diarrhea. We've seen chronic diarrhea that's been going on for years or decades stop within a week of giving some tributyrin. So sometimes I do give butyrate directly, or IBD. I'll often use some butyrate directly because the gut is so inflamed. That can be really helpful. But a lot of times, people don't necessarily want another supplement. If I'm not seeing those, major signs where I definitely want to add it in, I may just be, let's feed the butyrate producers. Yes, we can give the end product, but you're still not feeding them. I always think of like the butyrate is more like giving you healthy soil that's going to promote their growth, but you still got to feed them. They're not going to grow if you don't feed them. So you got to get the fiber in there. So I look at, you can feed them with the fiber. You could get the butyrate in there, and maybe you want to do both. They find that actually giving the butyrate and the fiber, which is promoting the environment and giving the fertilizer to feed them, you get an even stronger impact. So many different options, what we may do, any combination of those.
So that's only if those bacteria are on the lower sides. If they're higher, would you also still want to do that?
Depends what we're seeing. I mean, again, if the gut is highly inflamed, I may bring it in, or there's terrible diarrhea, I may do it more for symptomatic relief. But, if those bacteria are in good shape, we don't necessarily need to do that to encourage them to grow by shaping the environment, but there's still other reasons we might use butyrate.
Is it more of a concern when they're higher or lower?
It's low that it's more, there's usually a deficit of the short chain fatty acid butyrate if they're low, because if there's low populations, they're not making enough butyrate.
And that's
If
less than
they're
DL
high,
you're looking at, right? Less than DL.
well, these aren't the butyrate producers. Those are on the previous page.
You're talking about the commensal stuff here.
Yep. Yeah. So the three markers that represent them are the Firmicutes phyla at the very bottom. Yep. The Clostridia class, and then Faecalibacterium prausnitzii.
Okay, got it. So these are the big three: Clostridia, Faecalibacterium, and Firmicutes. These are the big
Yeah.
butyrate producers.
Yep.
Got it.
So if they're low, you could just try feeding them. Or if the gut's really inflamed, again, they don't like an inflamed environment. So you may bring the butyrate in to try to take down some of the inflammation and then give them the fiber, and now they're really going to grow.
Got it. Okay, very cool.
Mm-hmm.
Anything else you want to say about the Citrobacter or these despotic bacteria individually? I mean, a lot of these are going to be commonly found in SIBO, right? But because it's a stool test and all of it's moving through the intestines, we wouldn't necessarily say this is SIBO unless we had like a breath test, but we could say that's a kind of a generalized dysbiosis.
Yeah, and some of these bacteria we look at, like Klebsiella pseudomonas, they just live in the small intestine. That's just their area that they hang out. But it's not necessarily SIBO. Yes, they're in the small intestine, but SIBO is when there's too many overall bacteria in the small intestine. Sometimes you just have a dysbiosis. It may just be there's not too many overall. It's just Klebsiella and pseudomonas are too high.
And so you're going to utilize like a breath test, like a lactulose, where you're looking at hydrogen and methane gases to see if they're really elevated to really know that.
Yeah, if you wanted to see more of that SIBO picture, is there too many bacteria in the small intestine because maybe you had a food poisoning incident before and your migrating motor complex, that street sweeper isn't working well to push the bacteria out. But if I'm looking at this, I'm looking at, yes, these are in the small intestine, they're overgrowing, maybe there's other things overgrowing in the small intestine with them. But, to me, it's something I'm looking at, low
Mm-hmm.
stomach acid, low enzymes is a huge factor with bacteria in the small intestine. So many cases we can more work on digestion, H. pylori, get some antimicrobials in there, and it often takes care of those, even though they're in the small intestine versus a colon.
Cool. Anything else you want to say about these individual despotic critters?
Yeah, well, Klebsiella, since this one shows up, these are, besides being very pro-inflammatory, they are, putting you at increased risk of perhaps developing an autoimmune condition.
Mm-hmm.
So like Klebsiella is something that's been linked with rheumatoid arthritis,
Mm-hmm.
ankylosing spondylitis, IBD. So if you have that perfect storm, if you have the bacteria, which is your trigger, you have a leaky gut, and you have the genetics that make you predisposed to getting, say, rheumatoid arthritis, it could lead to that down the road. So that's where we're seeing signs, maybe you don't have rheumatoid arthritis now, but 10 years, 20 years, 30 years from now, if you don't do anything about this Klebsiella, it could turn into that. So that's where, again, we look from a functional medicine perspective. We want to try to head off a lot of these symptoms too. And that's where we can get a glimpse into that now with the stool testing to try to get rid of this now so it doesn't become a future problem.
Very cool. Anything else you want to say on these down below, the Proteus or the Fusobacterium?
Mm-hmm. Yeah, now some of these actually live in the mouth. So Klebsiella lives in the mouth, Prevotella lives in the mouth, Fusobacterium lives in the mouth. So we can't forget about other microbiomes too. So they're part of the oral
Or
microbiome.
microbiome?
And there's actually a lot of overlap. I think it's like 45% of the microbes are similar between the two. So we always have to look at oral health, dental health. If someone has issues in their mouth, maybe they need to get their teeth cleaned, get an infection dealt with. Because if you're swallowing these bacteria every day in your saliva, now, if you have low stomach acid, you don't kill them very well as they pass through the stomach. So you could get too many in your intestinal tract because there's low stomach acid, but you could also get too many in your intestinal tract because there's too many in your mouth. So we always have to be looking at the health of the mouth too and what's coming above the GI tract.
I'm a big fan of flushing either with colloidal silver or hydrogen peroxide. And if you're sensitive, you can always dilute it 3%. That's very helpful at knocking down some of those bugs. Do you agree?
Exactly. Yeah, exactly. A lot of people like water picks and they'll do different
Yep.
things and mix and sometimes they'll alternate too. And yep.
Mm-hmm.
And even the nasal, I mean, you have to figure, what your, is being swallowed there from the nasal passages.
Post
Sometimes
nasal drip stuff.
Yep. We'll squirt some silver or something up the nose too to try to kill something that's in there that's being swallowed and getting down in the gut.
Very good. Let's dive into yeast. I typically don't see a lot of yeast come back on these labs. When I do, it's usually beneath the reference range. Sometimes it's positive, but a lot of times I tell patients, if I see it here and it's not DL, then it's probably a concern. I mean, on the organic acid testing, which we can talk about at a later point, we'll see things like diarabinitol or diarabinose, which is a really good yeast marker, which I do find that tends to come up a little bit more frequently than this test. What's your take here?
Yeah, so yeast, again, we have to keep in mind, it can grow lots of places.
Mm-hmm.
It can grow in the mouth, in the stomach, in the small intestine, in the large
Skin,
intestine,
fingernails.
the skin. Yeah. So, I mean, of course, anything outside of the GI tract is not going to show up in the stool. If you have a toenail fungal infection, a scalp fungal infection, it's not going to come out in your poop unless it's also in your gut.
Yeah.
So we always have to keep in mind when people say, oh, I have a yeast problem, my toenail, look at my toenail. Why didn't it show up? It's like, because it's probably localized to your toenail.
Yeah.
Now, of course, again, we have the dilution factor. If you have thrush, if it's more in your mouth and not so much like in your colon, we may not see a huge amount in the stool or even in the stomach because it's going to be diluted out as it travels. So this is really good at looking at especially the lower bowel because it's right there ready to exit. The higher up in the GI tract you get, the more dilution is going to play a role into it, where sometimes maybe you will see it more in organic acids in a urine test than in the stool if it is a little more upper GI. Although, I mean, we do pick up DNA that's coming down from the mouth, the stomach as H. pylori shows up, small intestine. But this is something where if it's detected at all, to me, that's a problem because yeast overgrowth tends to cause a lot of symptoms, especially hits the gut and the brain. So a lot of people will say, yeah, I have the gas, the bloating, the constipation, the diarrhea, but it's also the brain
Brain
fog, the
fog.
memory. I can't remember where I put my keys. It's,
Yeah.
cognitive. My brain doesn't work like it used to.
The acetaldehyde produced from the candida, right?
Exactly. Candida
Hmm.
produces so many toxins. A lot of those affect the brain, or they have the sugar cravings. So it's like, I want to get healthy and I want to stop eating all these carbs and candy bars and everything, but I just can't. It's the candida calling out for it. So you got to
Yeah.
knock out the candida.
On the extreme side, you could have auto brewery syndrome where you're actually creating your own fermentation with it. There's a story of, this is true, a gentleman got pulled over and he was tested being drunk on the breathalyzer, but it was actually the yeast in his gut that like made their own little brewery in there and created alcohol from that metabolism that got him drunk. And a lot of cognitive people that feel drunk, feel brain fog, it could be from that yeast and all that fermentation happening.
Yeah. And other organisms can do that too. Klebsiella, another
Yeah.
one that can do that too. Yeah.
Ah, interesting. Good. Very cool. And then does it matter? I mean, obviously candida tends to be the bigger yeast. Most people know about that. And you have some subspecies here.
Mhm.
Any difference? Does it matter? Are you treating them the same way? Do they differentiate in symptoms at all?
Yeah, it's hard to say in symptoms. I mean, a lot of the yeast behave the same. A lot of
Mm-hmm.
times we're doing similar protocols, antifungal,
Mm-hmm.
fatty acids like caprylic acid,
Mm-hmm.
undecilinic acid, herbs like pau d'arco, berberine, oregano. So we're typically addressing them the same. Now, these are all can be normal inhabitants of the gut, like candida. You should have candida in your gut. It has a purpose. The whole thing is it's all about balance. If you get too much of it, creates all these toxins in excess, you can get symptoms. So same thing with these. And some of them are actually in your environment. Like rhodotorula is something that we sometimes see a little bit of that showing up. And certain areas of the country seem to have it more just in the environment. It's kind of like a pink colored fungi. So I'll tell people, it's like, do you have like a pink colored ring around your toilet or your tub or something like that in your bathroom? It could be rhodotorula.
Mm. Interesting. Anything else on this?
That's the main thing with the yeast there. Yeah.
How about the viruses?
Yeah. So the main reason the viruses are on the panel is when these viruses are reactivated in the colon, they've been linked with IBD. So we're looking for that association there
Mm.
with, colonic viral reactivation. Now, of course, we know that these viruses can live in many organs and tissues like Epstein-Barr virus and the thyroid gland. So it doesn't mean if these don't show up that you don't have the virus somewhere else in your thyroid and your liver, but this is looking more at the IBD colonic link.
Very cool. And then we have different parasites as well. We kind of already chatted about blasto earlier, but can you give us kind of the Reader's Digest on the critters here, on the bugs?
Yeah, so again, all of these can cause symptoms, in some cases very severe. Now, the ones I'd say tend to cause the worst symptoms would be the blastocystis hominis and Dientamoeba fragilis. Especially in kids, we can see, kids with just terrible tummy aches and pain and issues, maybe failure to thrive. They're just a little underweight for their age and,
Mm-hmm.
just a lot of behavioral issues. We see Dientamoeba fragilis come up a lot. Both the blasto and D. fragilis have been linked with IBS in studies. So we do often see some quite significant symptoms with them. Now, some of the oddball things, extraintestinal, you may see, with like
Mm-hmm.
joint pain. I think blasto and
Yep.
endolimax nana is another one. I've had a lot of people where it's like, I think I have Lyme disease. And so we've
Mm.
run a lot of good, because Lyme disease, you need a good test because it's hard to find. But if you do a good Lyme disease test, and it comes up negative, we've had people do that. And it's like, well, it's negative. What do I have? I mean, this joint pain is awful. And it's endolimax nana. So it has an affinity for the collagen related tissues. So you can see some pretty nasty joint, muscle, tendon, ligament issues with that one.
This is more collagen based, huh?
That's the endolimax nana.
Oh, yeah. Very
Yeah.
cool.
Yeah. So that's what I look for with that one. Well, if I see it show up and they say, well, I have no gut symptoms. It's like, well, when you work out at the gym, do you seem injury prone where it's like, oh, I was lifting weights and now I twisted my shoulder and oh, now I was trying to run and now my ankle hurts. And, or they just go, I'm 29 and I work out, I go for a run and I'm so sore and stiff in the morning. I don't think I should feel like this for 29 years old.
Exactly.
Yeah.
Very cool. Anything else on these? Pentatrichomonas at all?
Yeah, I mean, again, some of these just vague, just general gut related symptoms, any of these really could cause gas, bloating, abdominal pain, discomfort, constipation, or diarrhea. So, just general like IBS type symptoms.
Very cool.
Mhm.
Anything about the worms? I don't see the worms come back as much. I really don't. Do you?
Yeah, we don't see a lot of worms, fortunately, because they are a little trickier. We often do recommend deworming medications because it is very difficult to kill them with natural means.
Mm-hmm.
But yeah, I mean, worms can be quite nasty. Some of these are, small intestine too, and things like Ascaris is a roundworm. It doesn't, some of these worms, like the hookworms and things, they actually attach to the bowel wall. So they stay in place. I mean, they could suck your blood and stuff and, get the nutrients from the blood. But Ascaris is kind of free floating there. And the problem is because it's free floating, it's not attached, it sometimes gets into places where we really don't want it. And so they found it migrating into things like your gallbladder and, your lungs and other places. So that one, I mean, the big issue with these worms are they can create blockages in some cases with those big worms. Sometimes there can be blood loss, nutritional deficiencies too, because if they're, sucking your blood and damaging your gut, you could have impaired nutritional absorption. Now, in the US, we typically don't see these massive infections where there's like a big ball of worms, but you could have a couple worms and they could be causing a lot of issues. Yeah.
Interesting. Very good. And then anything else with I think the Trichurius, that's a whipworm, right?
Mhm.
Nectaris, is that a hook? I think. Not sure, hook or whip, but either way,
Yeah.
different worms there, which we're going to treat either with, typical medication like mebendazole, albendazole, Vermox, or, higher dose wormwood or artemisinin also tends to be very helpful with some of these too.
Yeah. And again, some of these, they all have different ways you can get infected. Like some of them, it could be walking barefoot on
Yeah,
a sandy beach.
I think
Others
this
it
one's
could
that way.
be, yeah, some of those worms are
Tricurious.
just, yeah. And others you could be, you're exposed to it through like there's pork tapeworms and,
Yep.
beef tapeworms and stuff. So again, it's looking at food quality and making sure that it's cooked thoroughly. You don't want to go to a restaurant and get the rare hamburger or be eating, a
Just make sure it's a
rare
good restaurant.
pig.
Make sure the
Yeah.
quality is good.
Exactly.
Make sure
Yeah.
it's like Wagyu from like a high 5-star restaurant at least. Yeah, for sure.
Yeah.
Cool. And then down below, we have a couple of markers here out of the gate, steatocrit, which is a marker for maldigested fat. So if we see a lot of fat in the stool, we're thinking potentially either gallbladder flow issues, maybe stones that are affecting flow. Maybe we don't have enough acids because acids are really important for the gallbladder to trigger and contract and make CCK. Elastase, another marker for the pancreas and enzyme production. And again, if you have low enzymes, HCl or acids are an important stimulator for making and activating enzymes. Any comments on those?
Yeah, so exactly. Yeah, so steatocrit has to do with fat malabsorption. Now, ideally, I'd like to see a less than DL here. So I really
Mm-hmm.
don't want to see malabsorbed fat showing up in the stool.
Mm-hmm.
So like this one isn't terrible. It's 6. So 6% of the stool was some undigested fat, but it's not ideal. So I'm looking for signs, why might that be? Is there a bile issue? Is there a lipase issue? Because
Mm-hmm.
those are the major things that are digesting your fat. Your bile from the, produced by the liver, secreted by the gallbladder,
Gallbladder, right?
or lipase is a pancreatic enzyme. So for
Correct.
me, then, if I see this, I look at the elastase one to go, okay, what's the lipase looking like?
Very cool.
Elastase one, healthy controls usually are above 500. So in this individual, I'd say, okay, lipase is probably a little low because we're only 388. So chances are if we get a good pancreatic enzyme in here with a nice amount of lipase, we'll clear up this fat malabsorption too.
Very cool. And then any feedback on the beta glucuronidase? Well, I'll just talk about it out of the bat. This one has a major effect from dysbiotic bacteria producing it, right? And so, but it also can affect hormone metabolism. So you have these bad bugs, maybe it's Klebsiella or gram-negative bacteria like Proteus or Citrobacter. It's going to make this enzyme that is going to take conjugated estrogen and it's going to deconjugate it and allow that estrogen to go back into circulation. Comments there?
Yeah. So exactly. We look at sources. Now, bacteria is the number one thing I look for. Do we have those species overgrowing that produce it? So then I go flip back to page 2 and 3 and go, do we have E. coli? Do we have high Bacteroidetes or Bacteroides fragilis? Do we have,
So you may look here. So you may look
I
at
look there.
Bacteroides. You may look at E.
Mhm.
coli, or what else? Anything
Yep.
else?
The Bacteroides fragilis at the top there. Clostridia class and Firmicutes phyla, some species. I mean, those are large groups, but there's some in there. If those are high, it may also be coming from there.
Now, this person doesn't have a lot of those either, and they still have it.
They
Again,
don't,
it's a
yeah.
sample, but
Yep. Now, the next page, do they have Staphylococcus? They
yeah.
do, and really high. Yeah, we have Staphylococcus species. Staphylococcus can also produce it. So
Yeah.
this person, I'd be going, okay, maybe the Staphylococcus is where it's coming from. So if we get the staph down, we could bring this down.
Mhm.
But yeah, the problem is, especially we look at, say this is a menstruating female. She's producing a lot of estrogen and she can't get rid of that estrogen. So they say beta glucuronidase kind of comes around like a pair of scissors. So say, your toxin, your estrogen goes through the liver, goes through glucuronidation, which is a detox pathway, and the body kind of packages it up nice and neat for elimination. So it puts the estrogen in a box, puts the lid on the box, ties a nice little bow around the box. Well, your beta glucuronidase comes around like a pair of scissors, snips the ribbon, lifts the lid, lets the estrogen out. So now estrogen gets to get reabsorbed, recirculate, and now you get estrogen dominance. So now you have PMS and menstrual cramps and breast tenderness and all of those types of symptoms.
Very good.
So, yeah.
And then occult blood, we can see this potentially from blood in the stool, for ulcerations, could be ulcerations in the stomach working its way down. A lot of times I find it could be from hemorrhoids. It's a common one too. The outer veins in the rectum area, they're dripping a little bit. Or if a woman's on their menses too, that could potentially drive that. Feedback there.
Exactly. Yeah. So ideally, I like to see it under a 5. That would be considered negative. 5 to 9, that's where we often think, oh, did you collect during your period? Are you constipated? Do you have hemorrhoids? That's a typical range. Anal fissures, maybe a constipated, there's a little tear or something.
Yep.
Above a 10, that's our red flag, because above a 10, we have to consider that, this could be IBD, colorectal cancer, polyps. We just don't want to miss any kind of pathology here. So this is where we look to see, is there something that makes sense or a diagnosis that makes sense? Say I see an occult blood of 35. Well, the person has ulcerative colitis. Okay, now we know why there may be blood. It makes sense. But if it's a 35 and there's no known reason for this to be, then we may need to repeat it. Some of the acute pathogens, again, if we go back to page 1, that E. coli, the O157, that one can cause bloody stool. So say that they got this nasty E. coli from a hamburger. Yep. And the EHEC, the enterohemorrhagic E. coli. Yeah, so they could cause bloody stool. So maybe if there was a little bit of blood, it was from an E. coli or something just passing through. So if it's above a 10, we often start by just repeating the occult blood to see, was it some fluky thing where it was an acute pathogen or something? But if you get 2 positive occult bloods, it's often referring out to see, you maybe need a colonoscopy, because again, we just don't want to miss. We've caught early stage colon cancer by catching some of these, occult blood levels that are creeping up.
Absolutely. And then we have IgA, which is going to be an immune marker. That's your kind of your mucosal membrane barrier that kind of hits all the mucuses. So mouth, intestinal tract, vaginal canal, urinary canal. So if we see something high, that could be some kind of an immune stress your immune system's fighting and going after. If it's low, it could be just chronic stress that's depleted that immune system and made you more vulnerable. Any thoughts on that?
Yeah, exactly. I mean, for me, low is a much bigger problem than high. High means the immune system's working.
Yeah, it's good.
It's attacking. It's attacking some microbe or
thing.
some food. But I mean, that's what it's supposed to do. If something's threatening it, it should go up. It should try to resolve it. Low means that it's burnt out from wear and tear, that constant assault, and it just can't mount a response. And when it's low, you're going to be more vulnerable to the E. coli's and the Yersinia and the H. pylori's and the parasites, because this is our first line defense. We got to have this nice and robust.
Absolutely. And then gluten antibodies. How often do you see this positive? I mean, I find it's going to drop if someone's on a healthy diet. They could still be gluten sensitive, but it will go down. So it may not be the best indication of, hey, you're gluten sensitive. And you may get a false security because you've kept your gluten out, and then you're thinking you're okay and you can add it back in, but it's going to be kind of exposure based, right?
Exactly. Yep. In order for the body to produce antibodies to something, it has to have that current exposure. Now, gluten antibodies can last for 3 to 6 months in the system from a single exposure. So if they've had gluten in the last 3 to 6 months, it could still be elevated from that. But if someone, if say they come in and they say, I've been gluten-free for 5 years, I shouldn't be seeing elevated antibodies. If I am, there's a problem. It's sneaking in somehow. And we do often see this. I saw, I think, 2 people earlier today who were diagnosed celiacs and it was high. That's not good. That means that they're still having that
Exposure.
exposure. So we got to figure out where it's coming from. That is not a good thing. And their
So what do you do?
calprotectin's really high
Yeah.
too.
And what do you do when people are like, no, I really haven't been getting exposed? I tend to say, well, is there cross contamination? Is it potentially going high because maybe there's an egg allergy, or they're eating some rice that's technically gluten-free but could still react? Or is it a dairy thing? What other foods could trigger that?
Yeah, so first I look for actual gluten cross-contamination, because most cases it's actually gluten. They didn't realize that the oats will be contaminated with gluten unless they're certified gluten-free. So it could be they're eating their regular old Quaker oats, they're going to have gluten. So we got to look for those. Or there's sprouted bread. Yeah, it's Ezekiel bread. It may have less gluten, but still has gluten. So we got to look for that. Or, oh, my boyfriend eats gluten and I kiss him right after after he eats the hamburger. That's going to be a source.
That's possible.
Or they kiss their dog. They feed their dog regular gluten kibble and they kiss their dog. So
that's
I
possible.
look at all of those. And they found that, eating out in restaurants, they did this great study a couple of years back, and they said about a third of all restaurant meals that you're being told are gluten-free tested positive when they're actually tested. And that went up to 50% for gluten-free pizza and gluten-free pasta. So basically, if you go out to a restaurant, you order the gluten-free pizza or pasta, it's a 50-50 shot whether you're actually getting gluten or not.
Yeah, it tends to be usually if you're going out, if you're getting like a steak or some steamed vegetables, usually you're okay. It tends to be more in the sauces, the thickeners, or even a spice. And so worst case, you season it yourself with your own sea salt at the table or something, just to make sure it's clean.
Yep. And some things too, I mean, I actually, because I am gluten sensitive, gluten triggers Hashimoto's for me. So I went gluten-free like 14 years ago, and my antibodies dropped and have never come back because I've stayed gluten-free.
It's great.
But I do test. I have this little testing device, and you put a pea-sized portion of the food in the device. It takes about 3 minutes and it'll tell you if it had gluten or not. So I will test if I buy some new food, especially if it says, manufactured in the same warehouse with wheat, dairy, all that kind of stuff. Or if I don't know, say if I want to eat out, I can put the food in the device and know if it's gluten-free or not. So I test stuff.
What's this device called?
Yeah, it's called NEMA. It's NIMA. So it's a NEMA Partners is the company you can buy it through. It's a cool little device. You have to buy these capsules that are one-time use, but you put the food in the device. So anytime I buy anything new, any packaged food, even supplements, I run it through my NEMA, because I was being gluten by a cinnamon powder. Like I ran one of these tests on myself and my anti-gliadin was a little high. And I thought, was the test wrong? This is impossible. I've been gluten-free for over a decade. It's got to be wrong. So I bought the NEMA then, this is a few years back, and tested everything I was eating, and an organic cinnamon powder the company grinds fresh in their facility tested positive. And I was eating this almost every day. I stopped eating it. 7 months later, retested, antibodies gone.
Wow. Okay. We'll put a link up on screen, put it in the show notes. That's crazy. Very cool.
Now, if I've ruled out that's the first thing I look for, because the majority of people, it is just gluten contamination. Now, if we've ruled that out, then I look at, okay, there's about 6 foods that are cross-reactive with gluten. There's dairy, there's yeast, there's corn, there's millet. So then we start to look at
other grains,
other things that, if you're continuing to eat dairy, then maybe there's an issue there. Yeah, they recently changed the website. I think it's nemapartners.com.
Okay, cool. I'll put it below in the show notes. Anyone's listening, tune back and you'll get that. That's great.
So sometimes we have to remove cross-reactive foods. So there can be other factors, but the problem is once you've lost oral tolerance to gluten, you can't get it back. So only food we know of that your body creates memory B cells to. So it is something like, for me, being gluten-free for like 14 years, I shouldn't have antibodies. But if I start eating gluten again, I will have antibodies because I've lost oral tolerance.
And that's why I like the genetic test, because you don't have to necessarily challenge it or know. If you have the HLA DQ2 or 8 or 1, alpha 1, beta 1 or 3, then it's a good chance that you have those gluten sensitivity, and you should probably stay away from it.
Mm-hmm. Yeah.
Any feedback on the genetics testing for the gluten?
Yeah, I think it's helpful. I mean, I like all of these tests. I mean, they always give you a little different piece of information. So I think it's helpful, a lot of times correlating the genetics with what we're seeing here.
Yeah.
So, I mean, the genetics don't tell you you are having a problem versus this tells you you are having a current
Mm-hmm.
problem. So I like both. And
Mm-hmm.
sometimes people need the information from both, because just seeing the genetics, they go, well, I could have a problem, but is that enough, a motivational factor to keep me from eating gluten? Versus if I see this and it's high, then I know, okay, my body is really not happy right now because of the gluten I'm eating. I definitely need to go gluten-free. So it depends what motivates someone. And again, if they haven't been eating gluten for a while, I don't want them challenging it. They could certainly, again, run this as is, like myself, eating the cinnamon. I thought I was gluten-free, but I was being glutened. So it showed up. So I
Very
tell
cool.
people, run the test as is, look at your genetics. I'd rather you do that than reintroducing gluten and now starting that inflammatory cascade that's going to last for 3 to 6 months.
Very cool. Well, let's just wrap this up here. Last couple of markers. And by the way, I know we chatted about probably a little bit ambitious wanting to go into the ion panel, but I'd love to have you back soon, Lisa, and really dive into the ion panel a little deeper. Would you open to that?
I would. I love
Yeah.
talking lab test interpretation.
Very
Yeah.
cool. So out of the gate here, calprotectin, really good test for inflammation produced by the white blood cells in the intestinal tract. It's a protein. And of course, zonulin is that protein that's a sign that tight junctions are being unzipped in the intestinal tract and potential gut permeability. Comments on that?
Yeah, so calprotectin is kind of a general marker for intestinal inflammation. Now with
Mm-hmm.
IBD, we can see this exceptionally high.
Very
So
high,
usually, yeah, the two things that are going to cause your highest levels are acute pathogens. So again, something like that nasty food poisoning E. coli, or something like your, IBD type thing. You could see upper hundreds or even thousands with that.
Yep.
Now, ideally, I want to see under 50. So a lot of people will see things like an 87 or 120, where I go, that's higher than I'd like. So again, we start looking at, okay, what's causing this colonic inflammation? Again, are you lacking butyrate producers? Do you have too many of these pro-inflammatory bugs? Do you have a parasite like blasto hanging out in your colon? So we're looking at all those other factors that could be causing inflammation. Or again, some of the food additives. Maybe you like to go to your grocery store and get rotisserie chicken. Well, a lot of rotisserie chickens have carrageenan in them. Carrageenan is a known pro-inflammatory food additive. So there's little things we can sometimes do to bring down our gut inflammation. But yeah, so that one's going to tell you about if your gut is inflamed or not. Zonulin tells you if your gut is leaky. Now, zonulin will, go up, it's triggered by things like gluten and gram-negative bacteria. They have an endotoxin, LPS, in them. So gluten and LPS are the top two triggers for zonulin. So again, I'm looking for, is antigliadin high? Do you have a lot of these bacteria that are overgrowing? Or again, do you eat GMO foods? Glyphosate's another trigger for zonulin. So if this is high, we need to look for what's triggering it. And then we're probably going to need to do some gut repair. Maybe we want an L-glutamine based powder, because we want to make sure that the gut damage is being healed up, the tight junctions are restored, the integrity of the gut barrier is restored.
Very cool. And then Lisa, you've given us so much information here. This is excellent. I'm going to recommend this to my patients here to kind of get a little bit more of a deeper dive if they want more intel. This is excellent. If people want to find out more about you, where's the best place to go?
Yeah, so I have a couple different websites. I work with practitioners, and right now my practice is closed to taking in new clients, but, may open up in the future. So my more client website is my last name, Pomeroy. So pomeroynaturalhealth.com. Now, if there are practitioners who want more, help on lab interpretation for their patients, or if they're interested in the different training courses I've created, that website for practitioners is pomeroyinstitute.com.
PomeroyNaturalHealth.com for patients, PomeroyInstitute.com for practitioners. We'll put the links below here so people can get to that faster. Anything else you want to leave the listeners today with, Lisa?
I guess just, they say all health begins in the gut, and I'm a true believer of that because I had so many issues. I mean, you almost name a pathogen on this report, I've had it.
Yeah.
Everything from roundworms to just about every protozoa to H. pylori, I've had it all. And I know how much, it just wreaked havoc on my gut for decades. So starting very young, my parents would always think, oh, she's coming down with the stomach flu because she just puked out of the blue. It was just the H. pylori and everything else, my low enzymes. So I had just a terrible, terrible gut. And so, for me, it was the functional lab testing that found these issues. That found the H. pylori, the parasites, the low enzymes, everything else. And so I just think, for me, it's just so important. And why I get so passionate about this is, for me, it was giving me the answers that I needed to restore my health. So,
excellent.
Yeah.
Well, you have a great story, Lisa. You did an excellent job presenting the information. I think people that are watching getting a lot of information out of it. So really appreciate it. Look forward to have you back on the show real soon.
Okay, sounds good.
Got a question for Dr. J? Go to beyondwellnessradio.com and click the questions button. Then tune in to hear the answer. Also, if you like the show, click below to review us on iTunes. For more Beyond Wellness Radio, go to beyondwellnessradio.com.